Welcome to the Florida CNA Practice Exam by Question Bank Hub. 60 questions with detailed rationales. Let's begin. Question 1. When washing your hands as a nursing assistant, what is the minimum amount of time you should scrub with soap? A. 10 seconds. B. 15 seconds. C. 20 seconds. D. 30 seconds. The correct answer is C. 20 seconds. The CDC and Florida regulations require a minimum of 20 seconds of friction when washing hands. This duration ensures adequate removal of transient microorganisms. Question 2. Standard precautions should be used. A. Only with infectious residents. B. With all residents at all times. C. Only when blood is visible. D. Only in isolation rooms. The correct answer is B. With all residents at all times. Standard precautions must be used with all patients at all times, assuming everyone is potentially infectious since many diseases have no initial symptoms. This approach prevents disease transmission in healthcare settings. Question 3. Which personal protective equipment, PPE, should be worn when emptying a urinary catheter bag? A. Mask only. B. Gloves only. C. Gloves and gown. D. Full protective gear. The correct answer is B. Gloves only. Gloves are required when handling urine or touching the catheter drainage system. A gown is only needed if splashing is likely to occur during the procedure. Question 4. When should you perform hand hygiene? A. Only before meals. B. Before and after each resident contact. C. Every hour. D. When hands look dirty. The correct answer is B. Before and after each resident contact. Hand hygiene must be performed before and after each resident contact to prevent cross-contamination between residents. This is the single most important infection control measure. Question 5. A resident on droplet precautions requires which protective equipment? A. N95 respirator. B. Surgical mask. C. Gloves only. D. Gown and goggles. The correct answer is B. Surgical mask. Droplet precautions require a surgical mask to prevent inhaling large respiratory droplets from coughs or sneezes. N95 respirators are for airborne precautions only. Question 6. Which is the correct order for removing personal protective equipment? A. Mask, gloves, gown, goggles. B. Gloves, gown, goggles, mask. C. Gown, gloves, mask, goggles. D. Gloves, goggles, gown, mask. The correct answer is B. Gloves, gown, goggles, mask. Remove gloves first, most contaminated, then gown, then goggles, and finally mask. This sequence prevents contaminating yourself during PPE removal. Question 7. Alcohol-based hand sanitizer is not effective against A. Influenza virus. B. Staphylococcus bacteria. C. Clostridium difficile spores. D. Common cold viruses. The correct answer is C. Clostridium difficile spores. Alcohol sanitizers don't kill C. difficile spores. Soap and water handwashing is required when caring for residents with C. diff infections. Question 8. Which infection is spread through airborne transmission? A. Influenza. B. Tuberculosis. C. Pneumonia. D. Urinary tract infection. The correct answer is B. Tuberculosis. Tuberculosis spreads via tiny airborne particles that can remain suspended in air for hours. It requires N95 respirators and negative pressure isolation rooms. Question 9. When is it acceptable to wear artificial nails as a CNA? A. If kept short. B. With gloves. C. On weekends only. D. Never. The correct answer is D. Never. Artificial nails are never acceptable for CNAs as they harbor more bacteria than natural nails and increase infection transmission risk, even with gloves. Question 10. A resident's room has a sign indicating contact precautions. This means you should A. Limit all physical contact. B. Wear gloves and gown for care. C. Only enter if necessary. D. Avoid touching the resident. The correct answer is B. Wear gloves and gown for care. Contact precautions require wearing gloves and gown when entering the room to prevent transmission of infections spread by direct contact or contaminated surfaces. Question 11. Normal adult resting pulse rate is A. 40 to 60 beats per minute. B. 60 to 100 beats per minute. C. 100 to 120 beats per minute. D. 120 to 140 beats per minute. The correct answer is B. 60 to 100 beats per minute. Normal adult resting pulse is 60 to 100 beats per minute. Rates below 60 indicate bradycardia, and rates above 100 indicate tachycardia. Question 12. When taking an oral temperature, you should wait how long after the resident has consumed hot or cold liquids? A. 5 minutes. B. 10 to 15 minutes. C. 20 to 30 minutes. D. 1 hour. The correct answer is B. 10 to 15 minutes. Wait 10 to 15 minutes after eating, drinking, smoking, or chewing gum to ensure accurate oral temperature reading, as these activities temporarily alter mouth temperature. Question 13. Which blood pressure reading requires immediate reporting to the nurse? A. 118/76. B. 128/82. C. 138/88. D. 188/112. The correct answer is D. 188/112. Blood pressure of 188/112 indicates hypertensive crisis requiring immediate medical intervention to prevent stroke or organ damage. Report immediately to the nurse. Question 14. Normal adult respiratory rate is A. 8 to 12 breaths per minute. B. 12 to 20 breaths per minute. C. 20 to 30 breaths per minute. D. 30 to 40 breaths per minute. The correct answer is B. 12 to 20 breaths per minute. Normal adult respiratory rate at rest is 12 to 20 breaths per minute. Below 12 indicates bradypnea, above 20 indicates tachypnea. Question 15. When counting respirations, one respiration equals A. 1 inhalation only. B. 1 exhalation only. C. 1 complete inhalation and exhalation. D. 2 complete breath cycles. The correct answer is C. 1 complete inhalation and exhalation. One respiration consists of 1 complete breathing cycle, both inhalation, breathing in, and exhalation, breathing out, together. Question 16. Which method provides the most accurate core body temperature? A. Oral. B. Axillary. C. Rectal. D. Tympanic. The correct answer is C. Rectal. Rectal temperature is the most accurate measure of core body temperature, unaffected by external factors. However, it requires specific orders due to being invasive. Question 17. The apical pulse is measured using A. Fingers at the wrist. B. A stethoscope at the heart apex. C. Fingers at the neck. D. A blood pressure cuff. The correct answer is B. A stethoscope at the heart apex. Apical pulse requires a stethoscope placed at the heart's apex, fifth intercostal space, midclavicular line. It's the most accurate method for irregular heartbeats. Question 18. A pulse oximeter measures A. Blood pressure. B. Oxygen saturation. C. Heart rate only. D. Body temperature. The correct answer is B. Oxygen saturation. A pulse oximeter measures oxygen saturation, SpO2, showing the percentage of hemoglobin carrying oxygen. Normal is 95 to 100%. It may also display pulse rate. Question 19. A resident's call light should be answered. A. Within 5 minutes of activation. B. As soon as possible after completing current tasks. C. Immediately, prioritizing urgent calls. D. When convenient during your routine. The correct answer is C. Immediately, prioritizing urgent calls. Call lights must be answered immediately as every call could indicate an emergency or urgent need. Prompt response prevents falls, injuries, and demonstrates respect for resident dignity. Question 20. Which of the following is a resident's legal right under OBRA? A. To request a different roommate. B. To refuse treatment after being informed. C. To choose their own daily schedule. D. To have family members provide all care. The correct answer is B. To refuse treatment after being informed. Under the Omnibus Budget Reconciliation Act, OBRA, residents have the fundamental right to refuse treatment after being informed of consequences. CNAs must document refusals and notify the nurse immediately. Question 21. HIPAA protects A. Residents' right to free medical care. B. Privacy of health information. C. Right to smoke in designated areas. D. Access to all facility records. The correct answer is B. Privacy of health information. HIPAA, Health Insurance Portability and Accountability Act, protects the privacy of health information, controlling who can access medical records and how information is shared. Question 22. When you observe unexplained bruises on a resident, you should A. Ask the resident what happened first. B. Document and report to family. C. Report to the nurse immediately. D. Wait to see if more appear. The correct answer is C. Report to the nurse immediately. Report unexplained bruises to the nurse immediately as potential abuse. You're a mandated reporter. Florida law requires immediate reporting with written follow-up within 24 hours. Question 23. DNR on a resident's chart means A. Do not resuscitate. B. Do not restrain. C. Daily nursing report. D. Diagnose and report. The correct answer is A. Do not resuscitate. DNR means do not resuscitate, no CPR or advanced life support if heart stops or breathing ceases. This legally binding order requires physician's signature. Residents still receive all other care and comfort measures. Question 24. Before entering a resident's room, you should always A. Check the care plan. B. Wash your hands. C. Knock and identify yourself. D. Put on gloves. The correct answer is C. Knock and identify yourself. Knocking and announcing yourself must come first to respect privacy, dignity, and the resident's right to their personal space. Their room is their home. Question 25. A competent resident has the right to refuse A. Only non-essential care. B. Only medications. C. Any treatment or procedure. D. Only uncomfortable procedures. The correct answer is C. Any treatment or procedure. Competent residents can refuse any treatment or procedure, even if life-threatening, as long as they understand the consequences. This is protected under informed consent laws. Question 26. Discussing a resident's condition in the elevator violates A. Standard precautions. B. HIPAA privacy rules. C. Fire safety codes. D. Infection control policies. The correct answer is B. HIPAA privacy rules. Discussing resident information in public spaces like elevators violates HIPAA because anyone can overhear. Violations can result in fines up to $50,000 plus termination. Question 27. When providing perineal care for a female resident, you should wipe A. Back to front. B. Front to back. C. In circular motions. D. Side to side. The correct answer is B. Front to back. Always wipe front to back to prevent introducing E. coli bacteria from the anal area into the urethra or vagina, which causes urinary tract infections. Question 28. When giving a bed bath, you should A. Expose the entire body at once. B. Uncover only the area being washed. C. Start with the feet and work up. D. Use hot water for comfort. The correct answer is B. Uncover only the area being washed. Uncover only the area being washed to maintain dignity, privacy, and prevent chilling. Cover the resident with a bath blanket and expose only one area at a time. Question 29. When assisting with dressing a resident who has weakness on the right side. A. Dress the left side first. B. Dress the right, weak, side first. C. Let them dress independently. D. Dress both sides simultaneously. The correct answer is B. Dress the right, weak, side first. Dress the weak side first, then the strong side. This minimizes movement of the affected side and reduces discomfort. Remember, dress weak first, undress weak last. Question 30. Dentures should be stored in A. Hot water. B. Cold water with denture cleaner. C. Dry container. D. Mouthwash. The correct answer is B. Cold water with denture cleaner. Store dentures in cold water, with denture tablet if available, to prevent warping and cracking. Hot water warps plastic, dry storage causes cracking, and mouthwash can damage denture material. Question 31. When shaving a male resident, you should shave A. Against hair growth for closeness. B. In the direction of hair growth. C. Using cold water. D. On dry skin. The correct answer is B. In the direction of hair growth. Shave in the direction of hair growth to prevent razor burn, ingrown hairs, and cuts. Warm water softens the beard, reducing cutting force by 70%. Question 32. Proper foot care includes A. Soaking feet for 30 minutes. B. Cutting toenails in a curved shape. C. Drying well between toes. D. Using very hot water. The correct answer is C. Drying well between toes. Dry well between toes to prevent fungal infections, athlete's foot, that thrive in moist environments. This is especially critical for diabetic residents. Question 33. When providing mouth care to an unconscious resident. A. Turn the head to the side. B. Use regular toothbrush only. C. Rinse with water. D. Leave dentures in. The correct answer is A. Turn the head to the side. Turn the unconscious resident's head to the side during mouth care to prevent aspiration if fluids pool in the mouth. Unconscious patients cannot protect their airway. Question 34. Toenails should be cut. A. Curved to match toe shape. B. Straight across. C. Very short. D. Weakly regardless of length. The correct answer is B, straight across. Cut toenails straight across to prevent ingrown toenails that can cause infection, especially dangerous for diabetics. Check facility policy as many require licensed staff to perform nail care for diabetic patients. Question 35. When lifting a heavy object, you should A. Bend at the waist to get closer to the object. B. Keep your feet shoulder-width apart. C. Bend your knees and keep your back straight. D. Hold the object away from your body. The correct answer is C. Bend your knees and keep your back straight. Proper body mechanics require bending your knees while keeping your back straight. This technique engages powerful leg muscles and maintains spinal alignment, preventing back injuries. Question 36. The fire safety acronym RACE stands for A. Remove, alert, confine, extinguish. B. Rescue, alarm, contain, extinguish. C. Remove, alarm, confine, evacuate. D. Rescue, alert, contain, evacuate. The correct answer is B. Rescue, alarm, contain, extinguish. RACE means rescue residents, alarm, pull alarm, contain, close doors, extinguish, if safe. First priority is always rescuing people from immediate danger. Question 37. When using a gait belt for transfer, you should grasp it. A. From the front. B. From behind with underhand grip. C. Around the chest instead. D. Under the arms. The correct answer is B. From behind with underhand grip. Grasp the gait belt from behind with an underhand grip, knuckles up, for maximum control and proper body mechanics. This position allows you to guide movement and catch the resident if they fall. Question 38. A confused resident is trying to climb out of bed. Your first action should be A. Apply a restraint. B. Find out why they want to get up. C. Call security. D. Give sedative medication. The correct answer is B. Find out why they want to get up. Find out why the resident is trying to get out of bed. They may need toileting, be in pain, or uncomfortable. Address the need causing the behavior rather than just restraining the behavior. Question 39. Which creates an immediate safety hazard? A. Call bell within reach. B. Water spill on floor. C. Bed in low position. D. Non-skid socks on resident. The correct answer is B. Water spill on floor. Water on the floor creates an immediate slip and fall hazard, the leading cause of facility injuries. Must clean immediately or mark with warning signs. Question 40. When should side rails be up? A. Always, for all residents. B. Only when ordered in care plan. C. Never, they're restraints. D. Only during meals. The correct answer is B. Only when ordered in care plan. Side rails should be up only when ordered by the care plan, as they're considered restraints requiring medical orders. Unauthorized use violates federal regulations and resident rights. Question 41. A mechanical lift requires A. 1 trained CNA. B. 2 trained CNAs. C. A nurse to operate. D. No special training. The correct answer is B. 2 trained CNAs. 2 trained CNAs are required to safely operate a mechanical lift, 1 to guide the resident and control the lift, 1 to position the sling and provide reassurance. Question 42. Which is considered a restraint? A. Gait belt. B. Wheelchair footrests. C. Side rails that prevent bed exit. D. Call light within reach. The correct answer is C. Side rails that prevent bed exit. Any device that restricts free movement that the resident cannot easily remove is a restraint. Side rails that prevent voluntary bed exit are restraints requiring orders and documentation. Question 43. Which nutrient is most important for wound healing? A. Carbohydrates. B. Fats. C. Protein. D. Vitamins. The correct answer is C. Protein. Protein is critical for wound healing, providing amino acids to synthesize collagen, form new blood vessels, and build tissue. The body requires 1.25 to 1.5 g/kg/day during healing. Question 44. A resident on a low-sodium diet should avoid A. Fresh fruits. B. White bread. C. Canned soup. D. Plain rice. The correct answer is C. Canned soup. Canned soups are very high in sodium, often 800 to 1,200 milligrams per serving. Fresh fruits, plain bread, and rice are naturally low in sodium. Question 45. NPO means the resident should receive A. Nothing by mouth. B. No protein only. C. Nutritional supplements. D. Normal diet. The correct answer is A. Nothing by mouth. NPO means nothing by mouth, absolutely no food, water, ice chips, gum, or candy. This critical order prevents aspiration during surgery or ensures accurate test results. Question 46. When feeding a resident, you should A. Rush to finish quickly. B. Sit at eye level. C. Stand above them. D. Mix all foods together. The correct answer is B. Sit at eye level. Sit at eye level when feeding to show respect and aid safe swallowing. This prevents power imbalance of standing over someone and allows proper neck alignment for swallowing. Question 47. Which prevents aspiration during feeding? A. Feeding quickly. B. Resident sitting upright at 90 degrees. C. Large bites of food. D. Talking while eating. The correct answer is B. Resident sitting upright at 90 degrees. Position residents sitting upright at 90 degrees during feeding to prevent aspiration by using gravity and maintaining proper swallowing mechanics. Question 48. A diabetic resident refuses breakfast. You should A. Force them to eat. B. Document and report to nurse immediately. C. Save the meal for later. D. Give candy instead. The correct answer is B. Document and report to nurse immediately. Document and report immediately when a diabetic refuses meals, as this risks dangerous hypoglycemia within 30 to 60 minutes, potentially causing confusion, falls, seizures, or coma. Question 49. When caring for a hearing-impaired resident, you should A. Shout to be heard. B. Face them when speaking. C. Speak to family instead. D. Use complex medical terms. The correct answer is B. Face them when speaking. Face hearing-impaired residents when speaking to allow lip reading and facial expression interpretation. Many hearing-impaired individuals understand 30 to 40% through lip reading. Question 50. A resident is crying about missing family. You should A. Tell them to stop crying. B. Listen and show empathy. C. Leave them alone. D. Call family immediately. The correct answer is B. Listen and show empathy. Listen and show empathy to provide therapeutic emotional support. Acknowledging feelings validates the resident's experience and builds trust. Question 51. Sundowning refers to A. Depression at night. B. Confusion increasing in evening. C. Sleeping all day. D. Fear of darkness. The correct answer is B. confusion increasing in evening. Sundowning refers to increased confusion and agitation in evening hours, characteristic of dementia patients due to circadian rhythm disruption. Question 52. When a confused resident asks repetitive questions, you should A. Tell them to stop asking. B. Answer patiently each time. C. Ignore the questions. D. Hide orientation cues like clocks. The correct answer is B. Answer patiently each time. Answer patiently each time to respect the resident's reality and reduce anxiety. Repetitive questions stem from memory loss, not rudeness. They genuinely don't remember asking before. Question 53. Body language accounts for what percentage of communication? A. 10%. B. 25%. C. 55%. D. 75%. The correct answer is C. 55%. Body language accounts for 55% of communication through posture, gestures, and facial expressions. Tone of voice is 38%, and actual words are only 7%. Question 54. The term dysphagia means A. Difficulty speaking. B. Difficulty swallowing. C. Difficulty breathing. D. Difficulty walking. The correct answer is B. Difficulty swallowing. Dysphagia means difficulty swallowing, affecting 15% of elderly and 50% of stroke patients. This is the leading cause of aspiration pneumonia in elderly. Question 55. BID means A. Before dinner. B. Twice a day. C. Bedtime. D. Between meals. The correct answer is B. Twice a day. BID means twice a day, bis and die in Latin. Common medical abbreviation used for medication schedules. Question 56. Edema means A. Swelling from fluid accumulation. B. Difficulty breathing. C. Dry skin. D. Excessive sweating. The correct answer is A. Swelling from fluid accumulation. Edema means swelling from fluid accumulation in tissue spaces, common in heart failure, kidney disease, and venous insufficiency. Question 57. The abbreviation AC means A. Aftercare. B. Before meals. C. Air conditioning. D. After meals. The correct answer is B. Before meals. AC means before meals, antisibum in Latin. Medications ordered AC are given 30 to 60 minutes before eating. Question 58. Fowler's position means the head of bed is raised. A. 15 to 30 degrees. B. 30 to 45 degrees. C. 45 to 60 degrees. D. Completely flat. The correct answer is C. 45 to 60 degrees. Fowler's position means the head of bed is raised 45 to 60 degrees. This aids breathing, eating, and conversation by using gravity. Question 59. Bedbound residents should be repositioned at least every A. 30 minutes. B. 1 hour. C. 2 hours. D. 4 hours. The correct answer is C. 2 hours. Reposition bedbound residents at least every 2 hours to prevent pressure injuries by restoring blood flow before tissue death occurs. Tissue death begins after 2 hours of unrelieved pressure. Question 60. A draw sheet should be used to A. Make the bed. B. Move residents up in bed. C. Cover the resident. D. Protect the mattress. The correct answer is B. Move residents up in bed. Use a draw sheet to move residents up in bed, reducing friction and shearing forces that damage skin. 2 staff members use the rolled sheet edges for proper leverage. Here is a glossary of important terms used throughout this exam. Take a moment to review these key healthcare concepts and abbreviations. Thank you for completing the Florida CNA Practice Exam from Question Bank Hub. Continue practicing to build your confidence and knowledge. For additional practice exam resources for this and other certifications, check out Question Bank Hub on Amazon. You'll find a link for this certification book in the description.